Good morning, everyone. Thank you very much for being here this morning. Many of you have heard me talk a little bit about the reshaping of the future of healthcare, but I want to take the next few minutes to talk about why this isn't just a slogan, but why it is absolutely a critical mission for us to build a better healthcare system for this community. I've had the privilege of being part of this organization for almost 30 years now, and during that period of time, I have talked to thousands of patients and families. Thankfully, the large majority of them with inspirational and courageous and heartwarming stories about how our team has helped them through some of the most difficult times in their lives. But unfortunately, over the last 5 years, I've also seen far too often the challenges our community has in getting things like a primary care physician, long surgical wait times, long access times for diagnostic imaging, challenging situations of being transferred to the home environment with inconsistent or limited support, and long waits for long-term care centers, all coupled together to create pressure on our emergency departments and have us really thinking about how do we create capacity for the future. At the Ottawa Hospital, we provide 60 to 70% of all adult acute care for everyone in this community, all of Western Quebec and all of Nunavut. But we provide 100% of everything that is complex in nature, much like the case that we just heard with Aaron. And Aaron, I gotta say, thank you for your courage to be here today and walking us through. Truly inspirational. If we're gonna do a better job for our healthcare system, we have to challenge the systems and models that have been here for decades and break down the historical silos to not just talk about how we build a hospital, but how we create a better integrated healthcare system that cares for people before they get to hospital, when they're in hospital, and definitively when they leave hospital. That is what reshaping healthcare is all about and where our future is upon us. Over the last 3 years, we have been driving forward with this direction, and now we have over 23 sites in this community. We've built community-based dialysis units, expanded cancer programs. We've built 2 private-public partnerships with surgical models to get people quicker access for cataract surgery and joint replacements, with plans to triple that in the coming years so we improve access to surgery in this community. We've built 150 transitional care beds to help people transition from hospital into other environments. And we have approval to build 2 long-term care homes, adding over 600 beds to this community, one of them which is currently going up at the Riverside. And we've recruited over 50 family physicians in the last 2 years and plans to triple that in the next 2 years to come to try and build capacity to get more than 100,000 people in this community a primary care doc. That is where we're focused in terms of trying to build a better system for the future. But the reality is technology and buildings is not what drive how we reshape healthcare. It's people. And thankfully, we have some of the leading physicians, researchers, and clinicians across Canada right here in Ottawa. We've recruited over 3,000 people over the last 2 years, and we'll continue to recruit more and more to ensure we've got a stable healthcare system for our friends and family in the future. Dr. Auer and her research team do remarkable things to advance discovery so that we're able to get life-threatening treatments and cures to various illnesses right here in Ottawa first. And we've developed dozens of partnerships with private sector companies as we continue to innovate and use artificial intelligence, new technology, and new devices to find more effective and more efficient ways to treat people, patients, and families. As we rebuild and reshape, though, one of the big foundations that's critical to reshaping healthcare is what we do with our digital infrastructure. By fall next year, 16 hospitals in this region will be on one electronic health record and one electronic platform. And the last 2 hospitals in the region will onboard in 2027. Over the course of the following years, as we build more family practices, as we build more community clinics, mental health clinics, long-term care homes, surgical centers, and start to reshape healthcare, they will be built on one digital platform with a goal in the coming years that no matter where you are in this healthcare system, you have access to one chart, and so do all your physician and care providers, regardless of where you are in the community. That is a key component to how we reshape healthcare for the future in Ottawa. Having said that, in the middle of that is probably the most important piece to how we reshape healthcare, which is the development of the new campus. This will be home to the leading trauma center in Canada, if not North America. As we build this, there'll be 640 private rooms with capacity to grow to 1,000 beds in the future should we need it. We'll develop a new research center which will be home to a neuroscience research program that will be one of the leading programs within Canada. And it'll be 2.5 to 3 million square feet of advanced technology as we build new ORs, critical care environments, mental health centers of excellence, neonatal and care units that will completely reshape in how we use advanced technology and new building infrastructure to provide care for our loved ones for the years to come. There are very few communities that get this opportunity across Canada, and we are very fortunate to have all 3 levels of government supporting this direction. And we are well into implementation. Over the course of the next 6 months, as we head towards spring 2026, we will open the first phase, which is the parking garage. And as we're continuing building on the parking garage, the team that is leading this is into the first components of the new build, which are things like site works and site preparation, to prepare the site that over the next approximately 8 to 12 months, as we complete 3 million square feet of detailed design, we will be ready to start pouring concrete for the new build, for both the research center and the main campus. You know, the reality is we often get caught up in the challenges of what we face day to day, and that's for us to manage collectively as we move forward. But where we're really focused is what is tomorrow. And tomorrow has a bright opportunity and a very positive future for us in Ottawa. And while we get caught up in those challenges, and I'm up here on behalf of 17,000 people giving you a glimpse of this, the reality is healthcare is a major building block in any community, and it's a community project at the core of it. And I can't thank you enough for each and every one of your support for helping us work towards not only raising our goal of achieving $500 million in our campaign, but as and more importantly, the many, many, many things many of you in this room and the countless hours people have spent here and across this community helping us work to achieving both our vision and our goal. And so on behalf of the Ottawa Hospital, I want to thank you for your commitment and support to helping us reshape the future of healthcare. Merci et bonne journée.